It is Thursday, April 29th. Untitled Chapter. Welcome to the Kahnawake COVID-19 Task Force Update. This is our 207th edition. And on today's program, we'll be visited for the first time in a while by Zacharie from the Kahnawake Youth Center. But first, with an update, is the Commissioner of Public Safety, Lloyd Phillips.
Thank you very much, Joe. Good afternoon, everybody. I'll just do a brief update this afternoon on some of the, the current state of affairs within the community. This will start off by some numbers, and as we speak today, there is 9 active cases within the community, and that's obviously up from what we've seen in recent weeks, where we had a good stretch of no cases in the community of almost 8 weeks. But unfortunately, in the past little while, we had this latest number of cases, and so currently we're sitting at 9. And also, this impacts in various ways up to 60 households in the community who are currently in various levels of isolation because of cases and potential contacts and such. So the stretch goes far beyond just the people who actually do turn positive for COVID, and the impacts are reaching in terms of, obviously, families are directly impacted. The stress level in the family is impacted. It also hits the workplaces. People can't go to work. And our organizations, sometimes it impacts on organizations' ability to provide essential services to our communities. So we again, that's why we keep emphasizing the fact about the need to remain vigilant and be safe, because one case with a number of contacts and the way we have to isolate could have tremendous ripple effects throughout the community. So again, we just want to relay that to the community. And also, it has been questioned a few times, and it was mentioned, but I'll say it again. Yes, we did have a confirmation of, we did have a case of a variant, within the community. So again, another reason why, we have to remain vigilant and take safety measures to heart. We know it's been long, and we know people are being tired of hearing, talking about measures and masks and distance and hygiene, and probably tired of hearing me say it. And maybe you're tired of me saying it. I'm tired of saying it, but it has to be said. We have to keep repeating the message because we can't get lax now. As I said several times, there is some light at the end of the tunnel. That tunnel is a little bit longer than we thought going back several weeks ago, but there's still that light, and we will get there. And collectively as a community, we will find a way, and we will persevere. Now, I just want to talk a little bit about some additional numbers in terms of the cases. Looking back, going in February, mid-February, in the community, as you see on the chart here, spread out over the age demographics, going back to February 15, but that's really when we had the last series of positive cases in and around the 15th. But if you see in the light blue section there, number of the age group, 10 to 19, so basically youth and teens. And if you fast forward to now, April, so you can see that is the largest sector that has increased. So if we're noticing that the cases in the community are impacting younger people, and the age group between 10 and 19 is the highest percentage of increase that we are seeing. We certainly understand that people in this age category generally do well with COVID-19, but let's not take that to the bank. That's never a guarantee that somebody in this age category can't get severely ill. But also, anybody in this age category, like I said earlier, if they are impacted by COVID-19 that impacts their entire family. Their entire family may be in isolation, impacting people's ability to work and earn a living and such. So it's noteworthy that this area and age group is the one that's most impacted during this time frame. That's why, moving forward and looking at some of the ideas and some of the communications that we're going to be working on is targeting this age category on ways to better communicate or continue to communicate with them to ensure that they are aware of the risk and aware of the impacts of some of the decisions that they may be making. As well as through the mental health subcommittee of the task force. There's a lot of discussion regarding this age category as well, because we understand, for the youth, it's difficult, to remain away from friends and away from families and such. It's hard on everybody, but certainly it's impacting the youth in a much more impactful way. School has been different, life has been different, everything around them has been different, and after over a year, it's certainly taken its toll. So that has not gone unnoticed, and there are strategies and stuff to be able to address that again in a meaningful way with that age category. And obviously, we look out to the entire community, for either elders or parents or a friend or a trusted colleague, to assist and reach out to the youth and explain to them the risks and explain to them the importance of us hanging in there just a little bit while longer, and to get through this. And if people need mental health services, they are available in our community. Contacting KSCS is always available. To get a hold of them. As well as in an event of a crisis, you can always contact the peacekeepers and they'll point you in the right direction and have an on-call worker, get a hold of you to talk you through the crisis. So again, that's a very important element. Because we know summer is here, a lot of people want to get some activities going, and we're trying to look at measures and reduce the measures as best as we can. But right now, we're kind of in a holding pattern, waiting more scientific data on some of these variants. But at the same time, trying to balance off and allowing people and the youth to have some level of activities. And that kind of leads me into our next guest will be coming on in just a minute, speaking in more detail about some of the youth activities in Kahnawake. So with that, we'll go on.
And thank you very much, Lloyd. And just to further talk a little bit about the difficulty of reaching the youth sometimes, because they don't necessarily watch this program or listen to the things that we put out there. Remember, parents, you have a heck of a lot of influence on your kids. You really do. And just mention it to them again and again, because it is so important. And as we see by the facts and figures, the figures don't lie. The impact is over there. And we do have to do everything in our power to just stay on top of this. Well, as Lloyd mentioned, summer is coming up, and it is very important to keep the kids active and safe. And talking about that will be the Director of Operations for the Kahnawake Youth Center, and here he is, Kyle Zacharie. Kyle.
Good afternoon, Kahnawake. So as Lloyd mentioned, I'm here to talk about summer programming and how we're going to be approaching it this year, our second summer within the pandemic. So as Lloyd was mentioning, it's very important, the physical and mental health of our youth, of our entire community, but looking at the youth from our end. And at the Kahnawake Youth Center, we take it very serious. So we make sure all health measures are in place, hand hygiene, masks, social distancing. And with that, I am going to be talking about our summer program, and we will be offering in 2021 our Summer Fun Day Camp. So there will be changes from what the community is used to when we talk Summer Fun Day Camp. There definitely will be reduced numbers, but we are going to offer our program the way we have in years past. So it will run from June 28th to August 13th. There will be 7 weeks of programming for our youth, and each one of these weeks are going to be completely fun and safe. You know, safe is the key word right now, especially with the charts that Lloyd just put up and showed within the community where the numbers are going. And like I said, we take it very serious. So this summer camp will be open to the entire community. It won't be set for essential services like it was last year. We are looking to reach out to all youth in the community because it is important for our youth to be to work on their physical health and their mental health and different things like that. So we want to be able to offer it to them. All of our trips, you can say, that we're going on have been selected for social distancing. So you're not going to see us heading to any amusement parks this year. We're not going to be heading to any water parks or things like that. We're going to be heading to places where we can definitely ensure it's safe. For example, beaches. Beaches are one place where we'll be heading to. Lloyd is another place where we're going to be heading to. So we're trying to keep it outside and as safe as possible. So with that being said, we will be running it 3 camps. We have a 5 to 8-year-old camp, we have a 9 to 12-year-old camp, and we do have teen activities that we are going to be doing because we understand that is a population which is doesn't have much to do right now, and we see those numbers climbing. So we want to offer them a safe environment to be able to work on their physical and mental health and just be active, because it has been a long 13 months for sure. Like I said, it is open to the entire community. We are going to be opening registration on May 20th at 9 a.m. There'll be a lot more information coming out from the Kahnawake Youth Center. You can check us on our website at kahnawakeyouthcenter.ca or on our Facebook page. And we're going to try to get out as much information as we can. Unfortunately, like years past where we could give you the set schedule, what it's going to look like, we have a very good idea, but it is changing because COVID is always changing and different places are opening and closing and numbers in different regions. So we're doing our best to get as much information out there. But we did want to come on here today and announce to the community that we are looking out for the youth of our community. We do want to offer them a fun, healthy, and safe place to go this summer with healthy activities. And like I said, as safe as possible with all of the health measures, hand hygiene, masking, different things like that. So keep an eye out for more information coming from the Kahnawake Youth Center. But for now, this is where we are. So heading into summer. Thank you very much.
And thank you very much, Kyle. And just a little note here before we leave. I know the numbers are up, and we have at this point 9 active cases, and we want to thank the community for making sure that they go and get tested so that we can really keep a handle on it and getting tested. And even if you get a positive diagnosis, we're able to stay on top of it and make sure that we keep as many people possible safe. So with that, at this point, we'd like to say thank you for joining us. Thank you to K1037 for running these at the same time that we do on Facebook Live. And on behalf of everyone, thanks, and we shall see you next time. Nyauko Adano, Onegiwahi.